Hello everyone, am I audible and visible to you? Okay, so myself Dr. Shital Ghataliya, your faculty for physiology. Welcome on the platform of Unacademy. Welcome to Unacademy Future Doctors. I did MD Physiology from MP Shah Medical College and I'm educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. Let us go through some subscription details of Unacademy. With the Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. You can even have a printed notes available with certain subscriptions. With iconic subscription, you can have access to the best from two of the best, Unacademy and Prep Ladder. With Unacademy, you will find various resources like well-structured live batches, recorded classes, competitive live tests and quizzes, and many more. Unacademy and Prep Ladder. With the Prep Ladder, you will find clinical and integrated essential video lectures from Dream Team, rapid revision and snapshot, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. Now, Unacademy came up with some special class feature. Now, what is this? Here, the classes will be highly interactive. There will be a poll for the learner. You can raise a hand and you can ask to your educator. You can interact with your educator now. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available. You can download the lecture notes and get access to the recorded classes. You can learn the from any time, anywhere. As I told you, there is a highly effective question bank. So more than 25,000 high yield clinical questions are there, which are based on latest exam pattern, and it includes detailed explanation. These all are toppers of NEET PG September 2021. Congratulations to all the toppers from NEET Unacademy. As I told you, there is a feature raise a hand. So now the classes will be highly interactive. You will be engaged with the quizzes, viva, doubt solving sessions, and many more. Unacademy Medical PG test is there, free test ritual and plus batch test ritual is there. With free test rituals, you will find educator curated test series, FMG grand test series, study with me YouTube test series, and many more. With plus batch test rituals, you will find NEET PG 2022 subject wise test series, NEET PG 2022 grand test series, and many more. So there are two batches: Focus FMG 2022 comprehensive batch. Duration is 6 months. Already started from 15th of December. Target NEET PG 2022 taste and discussion batch. Duration is 3 months. Already started from 15th of December. Both the subscription, iconic subscription and plus subscriptions, are available with various duration and different prices. You can use the code Shital10 to get additional discount. As I told you, there is a free test on Unacademy Educator Curated Test Series. Different scholarships are available for various ranks. You can check with the dates and time and subjects. Use the code Shital10 to unlock the free test. You can use the code 872878 to attend the free quiz on the app. Now, Unacademy came up with NEET PG 2022 All India mock test. So now you can taste your preparation journey. So you can use the code NPG10 to unlock the test and enroll. So now you complete your test preparation with Unacademy. Use the code NPG10. Enroll now. Now, come to today's topic, that is clinical questions of general physiology, different clinical questions which are important from MCQ point of view and exam point of view. First question, name important determinants of body water content. Now, what are the determinants? Different determinants are like age, body fat, gender. These all matters, right? So these are the important determinants of body water content. Now, how these all factor affects age? Here, water content is more in children, approximately on an average 60% of the body weight, out of the body weight, total body water is there, right? On an average. So in children it is 75%. 75% as compared to the adult it is 60%. In children it is 75%. That is because of the large surface area of the body. It reaches to the adult value when child become 1 year of age. So that is important to remember. Age factor in children it is 75%. In adult it is 60%. Why in children it is more? Because of the large body surface area. It reaches to the adult value 60% when child becomes 1 year of age. Then body fat. Total body water is inversely proportional to body fat. It means that higher the body fat, lower will be the total body water, right? Then gender. There is a difference in male and female as total body water content is concerned. In male, it is approximately 60% and in female, it is 50%. The reason behind that is in female, fat content is more. Body fat content is more. And higher the fat value, lower will be the total body water. In male, comparatively, skeletal muscle mass is more. In female, fat content, body fat content is more. So it is approximately 50%. Okay, this difference, gender difference is more marked when the male or female reaches to the puberty age. Now, different body different commonly used indicators to measure the body fluids. Question about the body fluids. Name different indicators which are used to measure total body fluids. Okay, this is important from MCQ point of view. See, total body water. To measure total body water, different indicators like deuterium, which is the most commonly used indicator, tritium and antipyrine is used. Okay, this is the most commonly used indicator to measure total body water. Okay, deuterium, that is the most commonly used indicator. Then extracellular fluid, to measure extracellular fluid, inulin is used. That is more commonly used. Okay, inulin is more commonly used. Apart from that, sucrose, mannitol, sodium thiosulfate, these all you can use. So inulins, this is asked. Okay, then plasma volume. To measure plasma volume, Evans blue dye is used. Indicator commonly used, Evans blue dye, and 125I albumin can also be used. Then for blood volume, For blood volume, 51 cr labeled red blood cells, they are used. Okay, there is also a formula. This is important for the formula based question. Okay, for the formula based question, plasma volume divided by 1 minus hematocrit value. Okay, so hematocrit value, or you can say packed cell volume, whatever it is. Okay, so by this formula you can measure the blood volume. Okay, so this can be asked. This is important formula based question. So plasma volume divided by 1 minus hematocrit value. So that is the formula to measure the blood volume. Then interstitial fluid. To measure interstitial fluid formula, this is again important formula based question. You subtract plasma volume from extracellular fluid volume. Okay, subtract plasma volume from extracellular fluid volume. So it will give you idea about interstitial fluid. This is the effect of addition of isotonic fluid. What is the effect of addition of isotonic fluid? Effect of addition of isotonic fluid. Isotonic means it is having the same osmolarity of like plasma. Same osmolarity like plasma. So whenever you add isotonic fluid in the body, water does not shift because having the same osmolarity. So water will not shift between extracellular fluid and intracellular fluid. Water will not shift. So here what will happen? Extracellular fluid volume increases. Okay, but there is no change in osmolarity of intracellular fluid and extracellular fluid. Simply extracellular fluid volume increases. Okay, so because extracellular fluid volume increases, then it will cause dilution, right? So plasma protein concentration and hematocrit value, okay, plasma protein concentration and hematocrit value will be reduced. Okay, extracellular fluid volume will be expanded but because it is isotonic, there will be no shift of the fluid, okay, in the intracellular, between the intracellular and extracellular fluid compartment. Simply extracellular fluid volume is expanding, right? So plasma protein and hematocrit concentration, that will be diluted, so it will reduce. And because of increase in the extracellular fluid volume, arterial blood pressure will increase. Okay, so that is the effect of addition of the isotonic fluid in the body. Now come to the next question, that is, what is the effect of loss of isotonic fluid from the body? Conditions like diarrhea. If isotonic fluid is lost out of the body, see here again, same way, it is osmolarity is the same. So what will happen? Extracellular fluid volume will be reduced because of the loss of the isotonic fluid. But there is no change in the osmolarity of intracellular fluid and extracellular fluid. So plasma protein and hematocrit value will increase because of the loss of the extracellular fluid volume. No change in the osmolarity. Okay, no change in the osmolarity of the intracellular fluid and extracellular fluid. Simply extracellular fluid volume reduces. So because of the loss of the isotonic fluid, plasma protein and hematocrit value will increase. So because of the decrease in the extracellular fluid volume, it causes decrease in the arterial blood pressure. Okay, so that is the law effect of the loss of isotonic fluid from the body. Now next question, what is the effect of excessive intake of NaCl? See, NaCl means these are osmotically active particles, right? Osmotically active particles. So whenever there is an excess of intake of NaCl, okay, it will cause increase in the osmolarity, increase in the osmolarity of extracellular fluid. Okay, because of the osmotically active particles, NaCl are there. Okay, so it increases the osmolarity of extracellular fluid volume. Now try to recall transport across the cell membrane. Wherever the osmotically active particles are there, it will cause movement of the water towards their side, right? It will cause movement of the water towards their side. So whenever increase in the osmolarity of extracellular fluid volume is there, it means it will cause shift of the water. Water will shift from intracellular fluid to extracellular fluid, right? Water will shift because of the increase in the osmolarity of the extracellular fluid. It will attract the fluid towards it. So water will shift from the intracellular fluid compartment. This is intracellular fluid. This is extracellular fluid. Here osmotically active particles are more. So it will take the fluid out of it, right? So fluid will move from intracellular to extracellular fluid compartment. So it means this way it keep on moving till it becomes equal. Osmolarity of extracellular and intracellular fluid compartment becomes equal. Till that time, that fluid movement, water movement will keep on occurring. Okay. So shift of water from intracellular fluid will cause increase in the extracellular fluid volume and decrease in the intracellular fluid volume because water is moving outside. So here extracellular fluid volume will increase and here this side intracellular fluid volume will be reduced. Here osmotically active particles are there, water is moving, so here it increases the extracellular fluid volume. Loss of fluid from the intracellular compartment means decrease in the intracellular fluid volume. So this is the effect of excess of intake of NaCl. So final effect is increase in the extracellular fluid volume and decrease in the intracellular. Increase in the extracellular, decrease in the intracellular fluid volume. Now, the next question. What is the effect of loss of NaCl out of the body? Conditions like Addison's disease, where aldosterone deficiency is there, right? So here what will happen? Aldosterone is responsible for sodium reabsorption and potassium excretion. Because of the reabsorption of the sodium, water will also reabsorb due to osmotic gradient, right? So sodium reabsorption is there. In exchange of sodium, potassium will be excreted out. Now because of the salt reabsorption, sodium reabsorption, it will cause water reabsorption also. So for everything we need aldosterone. In Addison's disease, aldosterone is not there. It means this mechanism will not be there, right? So it means that it will cause excess of loss of NaCl out of the body. So if NaCl is lost out of the body, it means that osmolarity of extracellular fluid will decrease, right? Osmolarity of extracellular fluid will decrease because of the lack of aldosterone. So more NaCl is lost, or you can say excreted via kidneys, right? So osmolarity of the extracellular fluid volume is less. Now see this one. Here NaCl is less, right? And more water is here in the extracellular fluid compartment. This is intracellular fluid compartment. So here water is more. So it will cause a shifting of the water in the intracellular fluid compartment, right? So water will shift. It will shift in the intracellular fluid, okay, inside the cell. So what it will cause, it this water will keep on shifting till the osmolarity becomes equal on both the sides, intracellular fluid compartment and extracellular fluid compartment, right? So water will shift from extracellular to intracellular fluid compartment. Now osmolarity equals when because of the shift of the water, extracellular fluid volume will decrease, right? And intracellular fluid volume will increase, okay? Intracellular fluid volume will increase and extracellular fluid volume will reduce. Now, because of decrease in the extracellular fluid volume, relatively plasma protein and hematocrit concentration will increase, right? Because of decrease in the extracellular fluid volume, decrease in the arterial blood pressure will occur. Okay, so this is the entire effect of loss of NaCl out of the body, or you can say lack of aldosterone or Addison's disease, right? So salt reabsorption will not occur. So more salt loss out of the body. If there is a more salt loss out of the body, extracellular fluid volume, osmolarity will reduce. If osmolarity reduces, means that in the outer side, on the extracellular fluid compartment, water is more, right? So more water means it causes movement of it in the cell. So it increases the intracellular fluid volume and decreases the extracellular fluid volume. It will maintain, it will make the osmolar concentration equal. Osmolarity becomes equal because of the shift of the water. So because decrease in the extracellular fluid volume, relatively plasma protein and hematocrit concentration increases. Decrease in the extracellular fluid volume means it will cause decrease in the arterial blood pressure. So that is the effect of loss of NaCl out of the body. Now, what is the effect of loss of water out of the body? Simply loss of the water out of the body. Different conditions like diabetes insipidus or excessive sweating in case of hot environment, that can also that causes loss of water out of the body. Okay, so here what will happen, because of the loss of the water, extracellular fluid volume decreases, right? Water is lost out of the body, so extracellular fluid volume decreases. So it will cause osmolarity of extracellular fluid volume more because volume is lost. Simply fluid part is lost. So osmolar concentration will increase relatively, right? Because of the sweating. So water will shift. So water will shift out of the intracellular fluid compartment. Now again, let us see here. This is intracellular fluid compartment. This is extracellular fluid compartment. Here there is a loss of water, so osmolarity increases. If the osmolarity increases, it will cause shift of the water to the extracellular fluid compartment till it becomes equal. Okay, so osmolarity of the intracellular fluid increases here because water is lost. Water moves from intracellular to extracellular fluid compartment, right? So till the osmolar concentration becomes equal. So extracellular here, because of the increase in the extracellular fluid osmolarity, it is attracting the water towards it, shifting the water from intracellular to the extracellular fluid compartment. So relatively now, intracellular fluid, in the intracellular fluid, osmolarity increases, so, and decrease in the intracellular fluid volume. So that is the effect of loss of water out of the body. Now, what is the effect of gain of water? If you take more water, okay, or conditions like syndrome of inappropriate antidiuretic hormone, if there is a gain of water, in that case there will be increase in the extracellular fluid volume. If extracellular fluid volume increases, it means that it will cause water to shift inside the cell, right? Wherever the water amount is more, it will cause movement of it on the opposite side. Solvent will move where the osmotically active particles are moved. Okay, so increase in the extracellular fluid volume means water will shift inside the cell. Okay, so osmolarity here, because of the shifting of water inside the cell, it will dilute, right? So in the intracellular fluid, osmolarity reduces, right, till it equals. Okay, the water movement will keep on occurring till it equals, osmolarity equals on both the sides. So osmolarity of the intracellular fluid decreases and there is increase in the intracellular fluid volume. Because water is shifting, it causes increase in the intracellular fluid volume and decrease in the osmolarity of intracellular fluid compartment. So that is the effect of change in the water or solute concentration either inside or outside the cell. Now, important question related to the transport across cell membrane. Transport across cell membrane. There are various transport mechanisms. Passive transport, active transport, vesicular transport. This is the table for the secondary active transport. Okay, secondary active transport, where already the active transport mechanism, here the energy is received from the ionic balance, ionic exchange across the cell membrane. Okay, so here there are two important active transports are mentioned. SGLT1 means sodium glucose transport 1 and 2, SGLT1 and 2. Okay, so these pumps are SGLT1. This is mainly located in small intestine, enterocytes. Okay, and it transports 2 sodium and 1 glucose inside the cell. This is the example of co-transport. Understand the word carefully. Co-transport means two things are moving in the same direction. It will bind with the protein, and this is one is for sodium binding site and one is for glucose binding site. So this SGLT1 is mainly located in the small intestine, enterocyte. It transports two sodium and one glucose in the cell. SGLT1 is important. This is the physiologically basis of the use of oral rehydration solution in diarrhea. Okay, this is important transporter. Okay, SGLT1. Okay, in diarrhea when you are giving ORS solution, this is important because you are giving the solution for the to maintain the hydration status of the individual. Then SGLT2. SGLT2 is located in the proximal convoluted tubule of the kidneys for glucose reabsorption. Okay, this is for glucose reabsorption. Mutation in SGLT2, it will cause isolated renal glycosuria because glucose reabsorption is affected. In proximal convoluted tubule of the nephron, 100% glucose will be reabsorbed. Okay, so by this mechanism, SGLT2 transport, okay, by this pump. Okay, so this is important for the second. This is the example of a secondary active transport mechanism. So SGLT2 is located in the proximal convoluted tubule and it causes glucose reabsorption. If there is a mutation in SGLT2, it will not be able to cause reabsorption of the glucose, so it will cause appearance glycosuria. It means loss of glucose via urine, right? So it causes isolated renal glycosuria, means because of some problem with the kidney, appearance of the glucose occurs in the urine, or you can say loss of glucose via urine, condition called as isolated renal glycosuria because of the mutation of SGLT2. Now come to the last question. Write features of Cartagena syndrome. This is important. Cartagena syndrome. This is something about the microtubular part. Okay, function of the cilia and flagella. So here there is a lack of motility. Lack of motility of cilia. Okay, it causes Cartagena syndrome. It is a typical triad. It is characterized by recurrent sinusitis, bronchiectasis, and situs invertus. Okay, means here the because cilia is responsible for the rotation of the internal organs during the development. So the organs are situated in it is like a mirror. Okay, so situs invertus will be there. So this is a typical triad. In male it will cause infertility also. Okay, because of the movement of the cilia. See, there is a lack of the motility of the cilia. So person is very prone for upper respiratory tract infection, bronchiectasis, situs invertus will be there, and it will cause infertility. In case of male, it will affect the motility of the sperm also, so causes infertility in male. So this is all about today's class. If you have any question, you can ask me. If you have any question, you can ask me. Hello, Ishu. Okay, so after 5 minutes, join me in the open house session where I will be discussing two MCQs related to the topic I covered just now. After 5 minutes at 9:40, I will be available for open house session. Join me there. Okay. Thank you so much, all of you. Join me in the open house session at 9:40. Okay, after 5 minutes I will be there in the open house session for the discussion of the MCQs. Okay, thank you so much. Subscribe on Academy Future Doctors channel and help us to reach to more and more number of students. Thank you so much.